continue the treatment with a PRP. My colleague already said what is a PRP. It's a simple procedure. We just need a specific medical device able sterile to withdraw the blood. Then we need just to centrifugate, and then we need to inject the PRP inside the dermis, or we can just apply on surface of the skin or on the mucosa. When we look at scientific paper, these have already proved the ability of a PRP for tissue regeneration, for promotion of angiogenesis, and for regrowth of fibroblasts. And specific articles have proved the effective in cosmetic surgery, in cosmetic medicine, and also in dermatology. You see a different paper. But if you have an overlook to this paper, we see that there is not a consensus in terms of efficacy of PRP in cosmetic medicine, probably because there is not a large series, and also there's not randomized studies. But also there are other problems when we do research. For example, there is a lack of standard protocol for preparation and for use the PRP. But also, it is a very, very important point, when we inject the PRP inside the dermis, the concentration of platelets and the growth factors is very high just for a few hours, and then we go down. This is the reason that we thought there is a way that we can continue the treatment for our patient at home in order to maintain the concentration higher for a longer time. And since 2012, we start to develop this medical device. And I'm going to show you in a second a small video. This basically is a poloxamer. I've got no time to show you all the detail, but basically what we need to understand that platelets are very sensitive and just break up when they are outside the blood. This is the reason that we made up an environment to make the platelet comfortable and don't open up very quickly. We see these poloxamer have different viscosity, different concentration, different temperature of action. I'm going to show you this idea that we had. You see, this medical device is in a liquid state. It's a liquid state when the temperature is below 25 degrees. So we just put on the fridge and we have a liquid. The reason that our device have to be liquid, because as you know, the PRP is a liquid and we need to mix this PRP with our medical device. At temperature below 25 degrees, you see, it remains liquid. When the temperature go up and over 30 degrees, this medical device becomes a gel, because when we want to stick inside the dermis, or I want to apply on the mucosa on top of the skin, I want a gel, because the gel keep the platelets and the growth factor more stable. You see the gel. Now we back, medical device, liquid. We see we already prep the PRP. And very easily we can mix the medical device with the PRP. Obviously, if some of you have ever tried to mix the PRP with a cream, with the other liquid, you will see that it's not very easy to mix up. There you go. When we have together medical device and PRP, it will maintain a liquid state. We are below 25 degrees. But when we inject to the skin, inside the skin, or when we put on top of the skin is 36, 37 degrees, it becomes a gel. You see, it's still liquid. We wait the temperature to go up. In a few seconds, we see that has become a gel. There you go. Obviously, what's very difficult to demonstrate that inside this medical device mixed with the PRP, the number of the platelets and the growth factors will stay stable in time. And we at university, we made all this research, we count the number of the platelets, we analyze the concentration of the growth factors. We use the EGF. Very quick, and these are results. You see that the platelets, the number of the platelets, it becomes stable. No, I got not the lights, but I got the lights. Anyway, you see the number of the platelet will stay higher for 72 hours. This has already been exercised because the platelet outside the blood will open up and the number drop very, very quickly. Obviously, after 72 hours, you see the number go down. Basically, we don't really need the platelets. What we need is the growth factors. See the behavior of the EGF. The EGF go up nearly 70 to 80 hours after it reach the peak and then go down. But if you look at the therapeutic concentration, it will stay higher for nearly seven days. It means that our medical device, when it's hatched with a PRP, can be effective for 1 week. It is the reason that we're able now to give to our patients a post-treatment therapy at home. Obviously, patient at home cannot put inside the skin, cannot inject themselves, but they can put on top of the skin. So, for example, see all the application after skin laser, when we want to treat mucosa problems, when we want to treat ulcers. All this study has been published in this open journal PRS. Also, got no time, but if you want to have a look at the studies that have been published, we proved the really effective of this home therapy with the PRP plus medical device. Thank you very much.
Thank you, Dr. Araco. I'll call now Dr. Kate Goldie.